نه. سلام میکنم به همه عزیزان که به ما اضافه میشن. Hello Cody. I'm introducing you in a couple of words in Farsi as we talked before, and then I will send you the request. Thanks for your patience and I look forward to hearing from you more. سلام به همه مخاطبین عزیز، شبتون بخیر. ما طبق معمول یه مقدار وای میستیم، جمله تکراری، یه مقدار وای میستیم که یه تعدادی از مخاطبان برسیم و بعد از اون شروع میکنیم. یه 20-30 ثانیه فرصت بدیم به یه تعداد حداقلی از مخاطبین برسیم، پس از اون انشالله شروع میکنیم. خب من یه توضیح کلا راجع به فرآیند لایف هامون بدم. ما هر هفته داریم، حالا یا شنبه یا یک شنبه، پیج خودم یه سری لایف ها رو، مسابقه زنده اینستاگرامی رو انجام میدیم با کسانی که توی دنیا دغدغه دارن برای سلامت نوازندگان. حالا یا کارشون اینه که پیشگیری بکنن یا بحث درمان رو دارن، مثل امشب که در واقع دکتر فیزیوتراپ به ما اضافه میشن. کسایی که دارن روی حوزه سلامت نوازندگان کار میکنن، داریم هر هفته باشون لایو میذاریم که بتونیم یه تبادل اطلاعات بکنیم و تا جایی که میتونیم موزیسین‌های ایرانی و موزیسین‌های کل دنیا رو تلاش کنیم که از این آسیب‌ها بتونن در وهله اول پیشگیری کنن، یا اگر در معرضش هستن بتونن همونجا استوپش کنن، نذارن بیشتر بره جلو، یا اگر که خدایی نکرده که امیدوارم اینجوری نباشه آسیب دیدن بتونن که در واقع بدونن که به کجا باید برای اینجور موضوع در واقع مراجعه کنن تا بتونن بهتر بشه اوضاعشون و بتونن به زندگی عادیشون برگردن. چون برای ما موزیسین هیچی سخته از این نیست نتونیم ساز بزنیم. من همیشه میگم موسیقی در واقع یه اعتیاده دیگه، یه اعتیاد خوبه که حالمون رو خوب میکنه وقتی ساز میزنیم. به همون طب وقتی که نمیتونیم ساز بزنیم قاعدتا مشکلات زیادی به همون پیش میاد. امشب طبق هر هفته که گفتم توی این لایو همون ما دکتر فیزیوتراپ رو خواهیم داشت از امریکا که راجع بک‌گراندش خودش برامون توضیح میده. از بولدر امریکا بهمون اضافه میشه. 9.5 ساعت با ما اختلاف ساعت دارن. الان اونجا 12 ظهره که کادی به ما اضافه خواهد شد. راجع به بک‌گراندش و اینکه چه کارایی کرده و چه اتفاقی افتاده که تصمیم گرفته روی موزیسین به صورت تخصصی کار کنه خودش برامون توضیح میده. و بعد از اون راجع به این یه سری ماسکیواسکلتن در واقع دیسوردر هست که راجع به اونا هم توضیح میده که یکی از میشه گفت بیماری رایجیه که موزیسینا به خاطر حرکات تکرار شونده پیدا میکنن. چون تصور بفرمایید من یه گیتاریستم و تایم میذارم هر روز تمرین آرپژ میکنم. خب من با این 4 تا انگشتم دارم آرپژ میزنم، انگشت پی آی ام و ای ام، و این فرآیند رو هم هی تکرار میکنم. حالا نوعای مختلف آرپژ میزنم ولی دارم از همین ماهیچا و از همین انگشتان هی کار میکشم. در واقع به این میگیم حرکات تکرار شونده و کشش های تکرار شونده. اگر که من این کار رو غیر اصولی و تحت فشار انجام بدم، موجب به وجود اومدن یه سری در واقع آسیب های نوازندگی میشه که نوعای مختلف داره. اصلا بیشمار تعدادشون متاسفانه زیاد شده و ما بعد ببینیم چجوری میتونیم در وهله اول از اینا جلوگیری کنیم و بعد از اون بتونیم درمانشون کنیم. ما توی فرآیند لایف های قبلی که داشتیم دیدیم که همه جا دنیا متاسفانه این هست. خیلی از دوستانی که ما اضافه شدن گفتن توی ارکسترهای مختلف نوازنده بزرگ دنیا دارن به تلاش آمپول و قرص و اینا خودشون به تامین‌ها میرسونن. و من چند وقت پیش داشتم یه مقاله میخوندم بالای 80% نوازندگان دارن تحت درد و فشار ساز میزنن. یه سریاشون خب اومدن رفتن آگاهی پیدا کردن از این مسئله جلوگیری کردن، ولی یه سری دیگه شون به طور ذاتی راحت میزدن. ما بقیه همه آسیب و درد و این اصلا اتفاق خوبی نیست. تلاش میکنیم اینو بتونیم کمتر کنیم. فکر کنم دیگه تعداد مخاطبینم اوکی، بیشتر از این منتظر نمونیم. من ببینم تایم چجوریه. خب 8 دقیقه هم رد کردیم. من اینو به حالت تایم خب 5 دقیقه و 36. اوکی. من اگر که چند تا نکته، همسر من یاسمن جان اینجا بامون هست. اگر سوالی بود بی زحمت در انتهای لایو ما کامنت ها رو باز میکنیم، به فارسی بنویسید، من میپرسم از کادی، چون فیزیوتراپی فکر میکنم خیلی خوب سوال داشته باشن. من از کادی سوال رو میکنم، بعد جوابی که داد مجددا به فارسی ترجمه میکنم. بی زحمت فارسی بنویسید که من متوجه سوال بشم. بعد یکی این مطلب و اینکه در طول لایو من کامنت رو میبندم، چون روی صورت مهمانمون میاد و نمیذاره که ما تصویرشو داشته باشیم. و همین، امیدوارم که لایو خوبی رو داشته باشیم و بتونیم کلی تجربه جالب توش کسب کنیم. من ریکوست رو برای کادی میفرستم و دیگه کم کم صحبت رو انگلیسی میکنم. مرسی که با ما هستید. امیدوارم که لایو جزایی باشه. Okay, hello everyone. Thanks for joining us. We are proud to host Cody, Dr. Cody Weisbach from the United States, Boulder, and he is a physical therapy who is a specialist for musicians and works about performance-related injuries and musculoskeletal disorders. We are so happy to host him tonight, and I will send him the request now. He will join us, and he is going to talk about himself more. راجب درمان تنیس البو بپرسید. حتما در انتها حتما میپرسم استاد. من کامنت ها رو میبندم و کادی رو دعوت میکنم. Okay, Cody, I'm sending you the request. Please accept it and join us. After that, I will just turn off the comments because it covers at the end of the session, and if the audience had a question, they can ask. Okay, Cody?
Hey.
Hello.
Hello.
Nice to meet you.
Good to meet you. Thank you so much for having me.
Thank you for accepting my invitation. How are you?
I'm doing very well today.
Thank you. How is the weather there? Is it cold?
Not too cold. We got a nice sunny day. We have a lot of fires in the area, so we have ash in the air. Something is going on around here, so the air is not great, and it smells like a campfire outside. But otherwise, a nice sunny day.
Oh, good. And how is the fire going? Is it still, burning?
We've had a couple in the state that have been going for a good couple weeks now. They're having a hard time getting under control.
Oh, they couldn't manage to get it under control?
No, not yet. Not up in the mountains can be hard terrain to work in. So.
Oh, yes. No, I see what you mean. Okay, Adi, let us know about yourself.
Sure. So I'm a physical therapist. I've been a physical therapist for almost 13 years now, I suppose. And I guess I've had a background in music my whole life. Music has been a part of my life since very early on. I took guitar lessons starting when I was 6 or so, and played a little bit of that, played saxophone and jazz saxophone all through high school. And then in college, played in a rock band, and we played, gigs around the Boulder and Denver area. But I like to say I never spent enough time in the practice room to get my own injury. And it became very clear that music was not going to be the career for me. So, I was always a reasonable musician, but never the best person in the room. And so I went on to physical therapy school and found it was something that I connected with very well. And so I kind of went along a career in physical therapy. I wasn't sure which direction I wanted to go. For a time, I thought I would be in academia teaching other physical therapists, but that never felt quite right. And while I did my training in Boston, Massachusetts, and lived there for a while. And there's the Berklee College of Music, which is a quite good music school in that area. And I ended up seeing several musicians. I fairly frequently see musicians from that school, and always thought, this is a really interesting group to work with, and I connect with them because they're interested in the same things that I am, and I kind of understand how, like with my background in anatomy and physiology and physical therapy and injury, can very much understand and see how how easily it would be to get injuries and how difficult they could be in the context of a musical performance, competitive space like that. But I was on kind of a different trajectory at that time, and so I never followed up with it, and then moved back to Colorado where I grew up, and I've got a family now, and so some of the career things took a back seat for a time when I had small children. And so where I was working wasn't the most satisfying work environment for me. It's a general practice, and whoever came in I would see and I would help them, and that was nice. But was really kind of struggling with who are my people, who are the people that I really care about and that I really feel like I could help. And it wasn't too long ago where one of my colleagues, we were in a meeting, and she talked about how she was on an internship in Chicago, and the therapist that she was working with there would go around to the various orchestras and work with the musicians there. And that was kind of the moment where things were like, that's the people that I need to be helping. And so from that point, it's kind of become, I guess, an obsession or something that I kind of have to do. There's just so much within the training that I've received that I feel like would be really helpful for musicians to know and understand. So I started reading. The first place I always start is the scientific literature, and so I start reading what's out there in terms of the research for musicians' health, and was surprised to find that there's an awful lot. And then start looking around the internet to see what's out there about musicians' health, and start to find there's not a whole lot. And so, I just started. I was kind of curious. I'm not a super serious musician myself. I wouldn't consider myself a talented musician. I do it as pretty daily and for fun as a passion thing, but kind of curious if I would be accepted by a musicians community. So I just started posting things on Instagram, things that I thought would be helpful, and was quite surprised to find that it was very positively received. And so started doing just more and more, and have begun meeting a bunches of really interesting people with really interesting problems, as well as other folks like yourself trying to help other musicians. And it seems like there's a little bit of a musicians' health movement going on, where music's starting to mature in terms of its understanding of injury mechanisms and what to do about it, and that it's a problem and that we might want to do something about it. And so it's been a really interesting, really like fulfilling area to work in so far. And it's still very early for me. This is only about a year that I've been going down this path, so still feel I have very much to prove to musicians that I'll be here for the long term, and that what I have is helpful. But this is certainly the direction that I foresee the rest of my career going.
Good. First of all, I have to mention that you made a really good decision. Working with musicians, a good one, and it's good for all the musicians, because as you said, there's lack of information about performance-related injuries, musculoskeletal musicians, and the problem is that sometimes the musician go to a doctor, and when they see a doctor, they become better, but the problem is that they do the wrong postures, the wrong exercise, the repetitive motions, and that's why again they receive another setback, which is awful, of course, for musicians. And it's one of the biggest problems. Lack of information is awful in musicians area, and that's why we are trying to inform more and more musicians about these injuries, and we are helping them prevent them, or even finding treatment, as you said, which is perfect. I want to ask you, do you still practice music? What is your principal instrument, and are you still interested?
Pardon me?
I want to ask you, do you still practice music, and what is your principal instrument?
Mostly guitar and trumpet right now. I played a little bit of trumpet. I didn't mention it. I played saxophone mostly. I got best at saxophone, but I played a little trumpet in middle school and high school as well. And I recently bought another trumpet. My saxophone's still in Massachusetts in great disrepair, so got a trumpet, and so I'll play that a little bit. The church that I go to has a small orchestra, so I play trumpet in the orchestra there, so I have people to play in front of. And then mostly playing guitar, just for myself or for my kids. We also have a piano up in our family room, so play a little bit of piano and get the kids up on on the piano and just have lots of opportunities for them to interact with it as well. But primarily guitar and trumpet right now.
Good, good. Because my principal instrument is guitar as well. So we have a lot to
I know it.
talk about, you know. Yes.
Yeah.
And I wanted to ask you something about during your visit in different orchestras. How did you find the musicians? How do they are they ignoring that pain, or let us know about them?
So I didn't get to visit the different orchestras. This was the kind of the story of one of my colleagues that spurred me to work with musicians. But you know, I've gotten to interact with several musicians virtually, and I'll get a couple these days in my practice. And typically, the most common thing that I hear is trying to ignore it until it's too bad to ignore. You know, trying to play through pain and I guess pretend it's not there, or pretend that it's something that kind of this no pain, no gain mindset, or that it's part of the expected, it's just expected, yeah. So just deal with it. And kind of suffering in silence and not really wanting to tell people about it. You know, I've heard stories of being afraid to tell conductors or professors about it for fear of being sent away or replaced, or telling them about it and being told directly to just work through it and to not complain. So that's kind of the most common patterns that I've come across, and seeing folks more and more coming to doing some, I guess, exploration and doing some kind of self-healing, kind of taking the long route around to some version of self-healing rather than a direct route. I've heard from a medical community standpoint, far too many people going to see a physician or physical therapist and hearing them getting told to just stop playing. And the pain will stop if you just stop playing. And that's might be true, but it's not useful.
Yes. Yes.
So I think largely the medical community to a pretty large degree, and I lump myself in that community, has failed musicians, because they get looked at as something other than somebody with a high performance, highly physical task that they're trying to complete. There's kind of this, they're just playing music.
Yes, unfortunately, there's a misconception between musicians that we shouldn't face an injury, which in my estimation is awful, because we are athletes of small muscles, and like the professional athletes who face injury, is going to happen for us as well. We have to be open and we have to express our feelings. Okay, I have faced an injury. I have to try to find something. Ignoring that doesn't do anything and just make it worse, as you know.
Yeah, and I think there's some interesting parallels between where athletics were, 20, 30, 40 years ago, and where music is now. There was a time in professional sports where it was unacceptable to have an injury, and you just don't talk about it, and you suffer through it, and you don't take care of your body, and the people who made it were just lucky. And then they've figured out through all this sports science that if you limit load in a smart way, people get better faster. If you expect injuries to happen and treat them early and appropriately, they get better quicker. That injuries are going to happen, and it's okay. Like if you're pushing the edge of what you're trying to do, something like that might happen, and it's not okay to ignore it. It is okay to address it early and get it right and get people back on track. And so it's just interesting to see where, in baseball where I am, they didn't used to have pitch counts. The pitcher could throw as many times as they wanted and just destroy their arm. And now professional baseball will limit how many pitches a pitcher throws at a time. So there's a lot of learning that's happened in another domain that I think hasn't quite made its way over to music, and I think it probably will at some point.
You mean that we are in that era, yes?
We're on the way.
Has experienced as well.
Yep. Yeah, you see another group that's trying to do something at a very high level, that's very physical, that has come through these same problems. They've just done it first, but they still get looked at, like athletics or sports gets looked at something that's different than music. So how could they be similar? But I think, as you've mentioned, some of the types of needs are very similar. It's just how we might go about it in a musician's context that needs to be adjusted a bit.
Yes, the problem is that musicians work with small muscles, which they can, you know, this muscle can get, in fact, injured more easily than big muscles. That's why musicians are facing more and more injuries these days, because just imagine we are working with these small muscles in our hands, in our palm, and, you know, taking care of those are really difficult. And let us know, do you usually tell your patients, who are musicians, of course, to have a, you know, a special diet and take care of their body, you know, nutritious meals?
Yeah. So there's many things that go into, if you think of an injury as just an overload of your body in a general sense that kind of has a focused area where you've been using the most. But things like sleep is an independent predictor of injury in musicians. The study's been done. So if you're not sleeping well, that's something that's going to increase your probability of injury. If you're fueling your body poorly, that's going to be a predictor. That's something else that's going to make it harder for those muscles to do their job and therefore fail earlier. If you're eating appropriately, but you're in the practice room for 4 hours and you've had no food during that time, your system is depleted. It's the same as, you know, that it doesn't matter how clean your diet is if you're not consuming calories when you need them. So that's you know, the sleep, diet, the kind of like mental health is a big part of it as well, and then what you're doing for your physical health is a part of it as well.
Yes.
So it's, they all kind of.
Do you tell your patients about the hydration of their body and how much water should they actually consume in a day?
Yeah. So one of the first things, I tend to take things from really general to really specific. So if I see somebody, it's usually because things have gotten really out of control. So the first step, things that I can do in my practice are hands-on techniques to try and put out the fire, and then trying to reestablish general healthy lifestyle habits. Drink water appropriately, eat appropriate food, sleep appropriately, rest appropriately, and move your body appropriately. If you start putting those healthy habits together, then a lot of good things happen, and then you can see where the smaller problems. Because once you have a big problem, everything hurts and everything appears to be a problem. And if you can get it under control, get some good healthy habits going, do some things to settle down the pain, then you can start to dive in and see on a more granular level where things are. But yeah, healthy, I think for musicians, just the easy, healthy habits, healthy lifestyles is, you know, I guess simple, not necessarily easy, because they'll require significant behavior change, but basic things that it sounds like as a group musicians aren't doing that well on, that could probably change their risk profile quite a bit.
Good. Thank you. Would you, Cody, give me actually a couple of seconds to translate what you said before into Farsi?
Oh, please, yeah.
Okay, thank you. یه نکته خیلی خوب که کادی اینجا گفتش راجع به خواب، گفتش که مطالعات اخیر نشون میده که نوازنده که خواب کافی ندارن، یا حتی موزیسین، چون همین حال نوازنده مثلا آواز میخونه طرف، خواب کافی ندارن که از دلایل اصلی در واقع آسیب دیدنه، به خاطر اینکه توی اون خواب خب قاعدتا ریکاوری بدن اتفاق میفته و وقتی که خواب درست نیست قطعا آدم آسیب میبینه. و بعد راجع به تغذیه صحبت کرد که تغذیه نامناسب چقدر میتونه موزیسین آسیب بزنه، چون دقیقاً ما رفتارمون خیلی ورزشکاری باید باشه و بعدم وقتی نوازنده هستیم. و بعدم که راجع به آب من ازش پرسیدم که مصرف آب خیلی زیاد رو توصیه میکنه، همونجوری که ما توی در واقع متدهای دیگه هم داریم که همه مصرف آب زیاد رو خیلی توصیه میکنه. Okay, Cody, thank you so much for your patience.
You bet.
And let me know, do you inform your patient about their daily activities, and if they have a wrong posture in their daily activities as well? Do you help them to correct those?
So it depends on the situation. So I think posture is it's an interesting area because it gets blamed for a lot of things, and the research is not there to indicate that it's as important as it gets emphasized. And you can also run into some. So there's two issues with posture. Number one is people believe that there is a perfect posture, and they will try to force themselves into a perfect posture, which becomes quite energy inefficient for themselves and causes more problems than good. So finding a customized right posture for a given activity is important, not the quote unquote perfect posture. And I like to think of it more as like, what's an efficient position for what you're doing, just because the posture has become so, I think, loaded as a word. I also think that how the words that we use and the ways that we think about things can influence how we are paying. There's loads of science that shows that your thoughts, feelings, and emotions influence your pain. And so if you have this misconceived notion that if you're not in the quote unquote correct posture, you start holding yourself more rigidly and start creating more problems. The second piece with posture is that it can make people, I guess, lose faith in the strength and the resilience of their body. It can make them feel fragile. Like if I'm not in a good position, then really bad things will happen. And so, I'll use posture pragmatically in that if people have an injury that's overflowing to their normal life and they're uncomfortable in a position, then we'll try and modify that position or posture in a way that makes it less painful. Also, if they're in a position where things are really flared up, so everything hurts really bad and they can't do anything, we can use posture as a way to protect those areas really effectively. So I will in those cases. But I also am somebody who believes that you need to, if you want to perform at a high level in a bunch of contexts, you need to be able to do so when things are not perfect as well. So if you need to have the confidence in your body and the resilience in your body, where if you end up in a gig situation where you don't have a piece of equipment that would give you that postural adjustment, or the setup is just not right, that you can still perform in that situation. We want a resilient, robust body that can perform in a lot of different contexts, and we want to use postural tools and ergonomic tools as a way to achieve a task, but not become overly reliant on them, because sometimes they go away.
Yes.
Does that make sense? So there's a lot of nuance to posture. So it's not, yes, you should always have perfect posture in every situation, because sometimes that can give a false, it's just not necessarily true from a science perspective. But we also want to say, we can't say that posture doesn't matter, because it can matter quite a bit. It's a matter of customizing the posture for the individual and the situation for the individual and the understanding of it and the flexibility of it for the individual.
Yes, I understand. And in MuseMuscle, we usually try to inform musicians that posture is individual specific, and every musician should find his own posture according to his physical condition and his height, for example, his weight, and if he has a long fingers or his fingers are short, of course. We try to inform them that posture is individual specific. I want to know, do you do that as well? For example, a musician comes to you and said, I have faced an injury, I have pain, for example, I don't know, in my hand, in my shoulder, in my chest, I don't know, wherever. And when you try to help him to address that injury and get better and heal, after that, do you help him to find his own specific posture?
Yeah, so one of the first things in any physical therapy examination is to assess posture. And one thing that should be a part to any exam with a musician is to assess the posture of the musician holding their instrument, both holding their instrument, playing something that's relatively simple, observing that from all angles, and playing something that's relatively complex and observing that from all angles, and checking for typical postural issues or inefficiencies or things like that. And so all of those can give you some ideas of thoughts of like, oh, we might be able to address that because I'm seeing their shoulder over here versus here, or, and it can change. Your posture I've seen people whose posture looks very different when they're not moving versus when they're holding their instrument versus playing something easy versus when something gets harder.
Yes.
It can change a lot. And so you need to, I think that's a tip for any musicians who are listening, is if you see a healthcare practitioner, ask them, you might have to explicitly ask them, can you check me out while I'm holding my instrument, playing something easy, playing something hard? That should be a part of the examination. If you're going to see a serious healthcare practitioner, and you're looking for an in-depth assessment of what's going on, the assessment with the instrument and while you're playing the instrument, I think, is really important because you can get some big clues out of that. And that also gives you a chance to, and even better, like I'll video it so that I can review it and I can put it in slow motion, I can draw angles on it and all this fun stuff. But that's something that you can use as a retest down the road as well. So you can look at a before and after and see if some of those things have improved, whether it's by adding, a material here, a bolster there, or a little bit of strength or a little bit of flexibility.
Well, thank you for the demonstration. It was really nice. There were good points, and I was following you, and I was enjoying everything. One of the good things that you said was about the hard pieces. When a musician face a hard piece, they usually rise their shoulder, or they actually put tensions in their muscles. Mm-hmm. They actually lose the symmetrical body side. Maybe they become like this or this way. They do something that they lose that symmetrical body side, and it's one of the turning points in facing injury, because by losing the symmetrical body side, one side of the body, of course, goes through a strain, and the other one through contractions, which makes the muscles difficult to work, of course. Would you give me a couple of seconds to translate this one as well?
Oh, please.
Thank you.
Go ahead.
نکته خیلی جالبی که کادی گفت وقتی که به ما مراجعه می‌کنن موزیسینا، ما در وهله اول می‌خوایم ازشون که تو حالت عادی پاسچرشون رو ببینیم اصلا تو حالت عادی درست وایمیسن، و بعد با ساز زدنشون یه حالت فقط ساز رو بگیرن، یه حالت قطعه خیلی ساده بزنن، یه حالت قطعه سخت بزنن که چک کنیم ببینیم تو هر کدوم از اینا چه اتفاقی میفته. و میگه وقتی که میرن به قطعه سخت، دیگه پاسچرشون شروع میکنه تغییر کردن، یه کج و موج شدن و اینا پر از انقباض. و نکته خیلی جالبه، میگه ما تو همونا بررسی میکنیم و تلاش میکنیم تو همه اونا در واقع اون انقباض و اون از بین ببریم و اون راحتی رو به وجود بیاریم. یه نکته هم که من از دفعه قبلی یادم رفت بگم، به جز خواب بحث استراحت بین تمرین‌ها هم بود که ما نوازنده هر روز پا میشن یه تعداد ساعتی ساز میزنن، این آسیب زننده است، باید حتما بینش آسیب در واقع ریکاوری و استراحت داشته باشیم. Okay, Cody, I'm with you again. Thank you for your patience.
You bet.
Okay, please let us know about musculoskeletal disorders. I think I personally want to know about them more.
All of the musculoskeletal disorders. So most common ones that a musician is going to face is a tendon problem, or what we'd call a peripheral nerve problem. So peripheral nerve problem being your carpal tunnels, thoracic outlets, cervical radiculopathies. A tendon problem being your tendinitis, tendinosis, tendinopathy, tennis elbow, those types of things, finger tendon problems. I think the way that I think about injuries in general, and it's, I guess, particularly useful for musicians, is I use an analogy. I use this analogy with my patients all of the time, and it's the analogy of the water in the cup. So if you have a cup and you pour water in it, if you keep pouring water in it, at some point it's going to overflow, and that's a problem. So the cup is your body, the water is everything that's going into it. And so you have three options to improve this. You can try and make your cup bigger, you can pour less water in, or as you pour in, you can try and drain water out. And so a musculoskeletal problem, I guess it's important to distinguish in musicians. It's not contact injuries. It's not a sprained ankle. It's not getting hit by somebody. It's an overuse injury. It's called a repetitive strain injury, whatever. So that analogy is how a repetitive strain injury happens. So the water going in is the amount of time that you're playing your instrument. It's just load on your body. So it's all the things like if you don't have good sleep, that's more water in the cup. If you aren't eating well, that's water in the cup. If you're emotionally stressed out, that's water in the cup. If your self-talk is bad, that's water in the cup. All of these things. And the cup is the physical resilience of your body, and then draining the cup is all of the good things that you can do. Self-massage drains some out. A good night's rest drains some out. The interventions that I use, the ways that I try and drain the cup quickly, I use dry needling, I use joint manipulations, I use soft tissue techniques. All of these are things that will drain the cup quickly. they're great techniques, but they don't fix the problem of too much water going into the cup. And it's what you said earlier with the, people going and seeing a doctor or somebody. So they've got this, my cup's too small, I'm trying to pour too much in. I have somebody empty it out for me a little bit, but I'm still dumping too much in. And so that's kind of we can either pour less in, make the cup bigger, or get better at draining it out. If you don't do that, you frequently, for musicians, you end up with a tendon injury. Your tendons get overloaded. And there's some interesting things that happen to the physiology of your tendons as well as to your pain system in that area. We can talk about using exercise to improve tendon health is an important understanding of it. And then the same thing can happen to your peripheral nerves. Your peripheral nerves are quite amazing little things. They send messages from your brain down these trunks in your arms, and along the way they slide and glide, and they go through little tunnels, and they bend and squish, and they still pass signals the whole time. And so if they encounter too much mechanical stress, then you can get an area, basically an area of small injury in that nerve, and you can start getting, instead of the impulse generating here and going down, you can get an impulse generating in the middle and going both directions, causing problems. So that's the nerve injury side of things. Those are a little more tricky. But both of them, the mechanics of this water in the cup analogy, hold true for both. That's the key. Too often people get focused on, I need to improve my pain in this spot here, versus I need to get better at improving this too much going in, not enough capacity to hold it, not draining it out effectively. So that's really the base. There's a difference between treating the symptoms and treating the problem in musculoskeletal injury. And so in order to treat the problem, it's like if you have a problem with your car and your check engine light comes on, you can either put tape over your check engine light or you can fix the problem in your car. And frequently, I think there's too much tape over the check engine light, not enough fixing the engine.
Yes, it was a really nice example. Thank you for demonstrating that.
Sure.
It's wonderful. I was imagining, and it was a vivid picture. I was putting myself in that situation. I was imagining myself in that situation. It was really good. Thank you. Thank you.
Sure.
And let us know which part of the body mostly is injured in musicians that come to you, of course. I mean, out of experience. Or,
I see more.
If he's a guitarist, you can say, for example, the pain problem was in his hand, or was in his shoulder area, or his elbow. What was the most typical one?
So I see more forearm, shoulder, neck. I see less hand because every clinic that I've worked in has a dedicated hand therapist. So I see less finger hand within my practice right now. But I saw a lot of, especially from Berkeley, there's a lot of guitarists at Berkeley, saw a lot of guitarists and bassists with forearm problems. So here's the other thing. This is an interesting piece, is that we can say that the source of the symptoms, like my pain, I'm perceiving my pain here in my forearm or here in my hand, but very frequently I'll find issues in the neck as well. So I had a drummer that I saw. This is kind of an extreme example, but he was a drummer. He taught drumming. He taught a tension-free particular technique of drumming, but he was in a car accident. So he got a whiplash injury, and his strength in his arm and his hand disappeared. That's common. So your nerves that innervate your hand come from your neck. And
yes.
So he had an injury at his neck, inhibited his hand, and he was having neck pain, but he was also having difficulty drumming, and found all of a sudden massive tension through that arm when he tried to play. And I think this is a really common profile for musicians. I'll almost always start looking closer to the center of their body and see if I can find clues that would say that there's a problem here that's contributing down here. So if you have an issue at your neck that is changing how the nerve is sending messages to your hand, that makes the cup that is your hand smaller without doing anything to your hand. And if we spend all of our time with the hand, frequently those problems kind of come and go. But if we start looking up the chain and notice, oh, there's a problem at this area of the neck that influences the innervation of this part of the hand, we can get ahead of it. So I haven't seen too many musicians where I haven't ended up doing some kind of treatment at the neck and some kind of exercise intervention at the neck, shoulder, and shoulder blade.
Okay. Thank you. May I translate this part as well?
Indeed, yes.
Thank you. یه نکته خیلی جالبی که کادی گفت در نظر بگیرید که بدن لیوان میمونه. البته من از عقب‌تر دارم ترجمه میکنم، میام به جلو. مثل لیوان میمونه. تایم تمرینی که شما دارید میکنید مثل اینه که آب دارید میریزید توی لیوانه. هر چقدر بیشتر تمرین میکنید بیشتر آب میریزید. مثلا اگه کم میخوابید بیشتر آب میریزید. اگر مثلا تمرینتون بدون فکر، بدون آگاهی، بیشتر آب میریزید. اگر به خودتون فشار میاره تحت انقباض بیشتر آب میریزید. خب این لیوانه سر میره. یه سری کارها هست که مثلا میمونه که من این لیوانه رو هی خالی کنم. کارهایی که میشه انجام داد مثلا اینکه مثلا من ماساژ میگیرم، به بدنم میرسم، تغذیه خوب دارم، خواب خوب دارم، استراحت خوب دارم. تمام کارهای این شکلی که میتونه کمک کننده به بدن باشه باعث میشه اون لیوانه خالی شه. خب من اگر که این کارهایی که در واقع مفید، یعنی یکیش هم مثلا میگفت خوب فکر کردن، به چیزای مثبت فکر کردن، چیزایی که باعث میشه هی آب اون لیوانه رو خالی کنم انجام ندم، هی چیز دارم توش آب میریزم، خب لیوانه سر میره. مثل بدن من که هی دارم تمرین میکنم، هی دارم افکار منفی میارم، هی دارم فشار میذارم و بعد هی ساز میزنم، خب قاعدتا آسیب میبینم چون من هیچی از این لیوانه خالی نکردم، فقط دارم پرش میکنم. خب این لیوانه سرریز میشه. بعد یه موزیسینایی که من در اون مراجعه میکنم بیشترشون توی ناحیه گردن و کتف و شونه آسیب دارن تا دست، چون از بالا فشار رو میارن بیشتر توی اون قسمت آسیب دارن. خب دیگه من طولانیش نمیکنم، میرم برای ادامه قضیه و اینکه okay Cody, we are with you again. Thank you for your patience. Okay, let us know, how do you address these injuries? I mean, you understand that the most part that face injury is the neck and the shoulder. How do you try to fix that? What's the first step? I want to know.
So it depends on the problem. So there's there's a variety of different problems that one can encounter. So if it's an area where you've got some stiffness in the lower neck, then we can do some hands-on work and some self-mobility to free up some space there so that nerve can slide and glide and move more appropriately. In some cases, that's working just fine, but we're seeing that the strength, endurance, and the motor control around the neck is not what it needs to be. So with muscles, with any muscle group, and very frequently around the head, neck, shoulder blade, it's this complex interplay of muscles. So it's not just one. You'll frequently see that it's not one muscle that's weak, but it's that the muscles are not acting in a coordinated way together. I use the rowers in a boat analogy. If you have 8 rowers rowing in a boat and they're all adequately strong, but they're all rowing at a different time, your boat is going to go slow. And so that's a very common problem around the neck. So if you have inefficiencies of how your muscles are functioning around the neck, that can load up different parts and start causing problems as well. So it's really a kind of doing an individualized assessment and treating what you see. Most common we'll see, so there's a muscle group. If I were to say like the easy things that I see most often and that's most connected to these types of problems in the research, and this is both for neck pain, neck influencing shoulder, and there's also a fair amount of research on neck influencing like tennis elbow type problems. It's the muscles of your deep neck flexors. So there's a small muscle group that sits down here that does this little chin tuck movement. Problems with those deep muscles and with the pattern. So you use these bigger muscles here instead of your smaller stabilizer muscles. I intend to interpret that as your body's trying to give you a brace. Your body's trying to help you. So that deep neck flexor muscle group, training the coordination and the endurance of that group through a chin tucking exercise is a big one. Shoulder blade muscles, your middle trap and your lower trap, and your serratus anterior muscles, so 3 of your big shoulder blade muscles, we'll frequently see those underperforming. And then the smaller muscles in the back part of your rotator cuff, we'll frequently see those underperforming. And so it can happen if you have those 3 muscle groups that are not performing in a way that would be helpful for you. You start seeing this classic upper trap muscle, levator muscle, shoulder muscles trying to act like neck muscles. and they get stiff and tight and sore and load things up in ways that are not helpful. So you can massage that all day long, but they're trying to help you. They're trying to do the right thing for you. They're trying to support things because other areas of your body are not. And so most common would be some kind of rotator cuff strengthening, some type of shoulder blade strengthening, some type of deep neck strengthening. And an approach like that, so there's a couple of studies that have been done on injury exercises for musicians using the professional orchestras in Australia. Doing an approach that trains those muscle groups is quite beneficial both in preventing pain and reducing current pain without assessment.
You mentioned something interesting here that I want to address. You said that maybe there's a problem with the coordination of the muscle. For example, you said one of the muscles is not working properly, and you have to use the other muscles more, which tends to, having an overuse injury. How do you help the patients to have a coordination in the muscle groups?
Same as you train somebody to play music. You find the level that's it's very, very similar neurologically to learning how to play. You have to start. You have to start at a level that the person can do, and you have to give them a way to know when they're making mistakes, when they're doing their compensation. Music, it's very easy because the feedback loop is that it sounds bad. You do something, you do it incorrectly, it sounds bad. With people's movement, it gets tricky because an abnormal pattern can be done so frequently that it feels normal. So you have to give some way for somebody to recognize that, oh, that's not what I'm looking for, it's this. So frequently with these chin tuck muscles, it's touching these bigger muscles here and seeing if you can do that chin tuck movement without those muscles firing. And people are frequently shocked to find that that's actually quite challenging. Same, there's a bunch of different ways that we can cue in those muscles, and frequently the positions that get used are ones that make it hard to compensate. The exercise positions that get used.
Yes. When we give them the exercise, these exercises are they contemporary, or they have to do them for the whole life?
No. So these are looking at areas that, if I tend to think of things as like, what's the standard and where are you in relation to standard? So for a lot of these body areas, there are physical performance tests that you can do with data that show how are you compared to age-matched norms. And so my argument would be that musicians, as physical as they are, probably don't want to be below average, probably don't want to be average in some of these areas, probably want to be a little above average. And what, in some of these studies that have been done on musicians with these professional orchestras in Australia, the people carrying out these studies and the physical therapists doing the examinations are quite shocked to find that in a professional orchestral setting, musicians are, well below what they would expect for the level of performance that they have. Yes. And that kind of tracks with what you might expect for such high injury levels. So
the problem is that when we are taught the music, when somebody is teaching us the music, we don't have anything else, just parallel to that. I believe that as a musician, for example, we have to know anatomical, the anatomy of our body. We have to know more about our diet, as you mentioned, our sleep, our rest. But we, as a musician, they just teach us to play the music better. They never teach us how to care about our body. The problem is that.
Yep, and that's exactly why my project got called Musicians Maintenance, because I think that maintaining and one of the early things that I put out there that connected with people was, if you're spending more time and money maintaining your instrument than you are maintaining yourself, you might want to reconsider your priorities, because you can always buy another instrument.
Yes. Yes, and it's impossible to buy another instrument.
Yeah. No. Yeah. No. So yeah, I think there's a cultural shift of musicians being more curious about how their body works, and kind of an understanding of just the physicality that musician has, that playing music has, and that your body is a wildly important part of creating that music. And And so I don't know, I think it's an interesting cultural problem because you kind of have like it's much easier for sports athletes to become interested in like what are the muscle groups, because
Yes.
by getting bigger, stronger, and faster, it can make you better at your sport to a degree. So there's kind of a big reward for that. By getting bigger, stronger, and faster, you don't get better at music.
Yes.
So the approach has to be a little bit different. So for musicians, it's important to move their body and to learn about their body, but it's pretty much all musicians are going to intuitively know bigger, stronger, faster doesn't make me better at playing my instrument. But it is important to have a body that is resilient enough that it can handle the physical load that is playing your instrument at a high enough volume to get really good at it. So, yes. Once that connection is made, because I think sometimes some musicians are a little bit standoffish about exercise because it gets associated with kind of like the big athletes that picked on them in school, and so I think just reconceptualizing that a little bit and helping musicians understand that movement and exercise is a important part of caring for you as a human, regardless of what you're doing. And if you are interested in a goal that is so physical as playing music, even though it doesn't look it, people don't accept it as it, or your friends and family might not recognize that as a physical endeavor, but musicians tend to feel it. That engaging in something that physical, it's important to understand your physicality and how that side of things can make you a better musician as well.
Yes, I agree. And you mentioned about musicians maintenance. It's a nice name anyway. I really like it myself. And when you told me about the idea that musicians should maintain their body as they maintain the instrument, I said, yes, what a wonderful idea. It's a really nice name and I like it. I want to ask you, tell me about the musician's maintenance. Is that only you, or you have others that may help you?
Nope, just me.
It's just you.
Just me, yeah. Small operation.
Yes, but it's a really good one. I like it. Yes.
No, really, the main, all I'm trying to do is take the things that so the health and fitness landscapes can be really confusing to navigate. There's so much information out there, and it's hard to tell, like, is this information good for a musician, or is this information good for a runner? And it doesn't always match. So I'm really, all I'm trying to do with that is go through the resources that are out there and put together the ones that I think are, like, weed out all of the noise and put together ones that I think would be helpful and actionable for musicians, both in terms of understanding their body and giving some appropriate exercises to try.
Mm-hmm. And I just have a favor.
Sure.
Post more videos of the exercises, because I personally like to experience those exercises, and if you more about them, we would all enjoy it. It's a big favor.
That's one of the.
It's a bit time consuming, I know, but for musicians.
Yeah, so one of the things that I'm trying to do is figure out how to carve out more time to make things. So I put together a group of exercises and a basic exercise program that's on YouTube. And something that I would like to do is be able to do more of. Currently, the musician's maintenance as it is a passion project that I'm putting money into and trying to find ways to keep it going, because I think it's interesting and important, and it brings a lot of value to me, and hopefully it brings value to others, and trying to find ways to carve out a little bit more time to make more things, because it's very fun.
Yes. And for the last question, I want to ask you something, and after that, I think we will reach the limited time of Instagram, which is 1 hour. We will stop the live and start another one. I will open the comments and let the audience ask if they had any question. But as the last, we have started a movement. It's, I think, for a long time to gather all the people who are experts in performance-related injuries to make a community and help musicians know more about themselves. And we believe that every approach, of course, advantages, and if they just come together, they would help musicians to stay healthy, prevent those injuries. How do you think we can actually fulfill this aim?
So, you know, I basically what I've found is it's just making relationships like this. Like, it's great to get to talk to you and get to know you. And I've had, so while the whole COVID situation really took a chunk out of my work, so I spent the time just, you know, finding other people who are interested in it and just saying, hey, do you want to jump on a Zoom and just chat, like get to know each other? And so I think it starts with that. I think and what I found is that it's a very collaborative environment, and everybody understands that it's not one approach. It's not all about me. It's ideas that I have are going to connect with people one way. Ideas that you have are going to connect with people a different way, and finding a way for all of us to come together and, you know, point, you know, we've all got people asking us questions from different areas and like, oh, I think this would be a great question. Like, you'd do really well over here. And just, you know, I think it's going to be hard to centralize things and have one group, but kind of this, I think it's interesting to have this a little bit decentralized, lots of relationships and talking and trading ideas and informal meetings and just kind of brainstorming how we can help each other and how we can help each other help musicians more is the biggest thing. Because I think that's what musicians need is a bunch of people who are really dedicated and passionate about helping them, working together and kind of pushing each other to see what we can do.
Yes, and we truly believe that these approaches should be a mandatory course in the universities and schools, you know, because musicians should learn them parallel to their study of music to help them prevent these injuries, to help them know more about their body. What do you think about that?
I just got invited to do one, so I'm all the way on board. You know, I think different places are more or less progressive about it and doing it in some different ways. But yeah, a school in Canada recently invited me to do something. So I think that's, you know, they're clearly a more progressive school. Here at the University of Colorado School of Music, they have a musicians wellness program that's been going on for a while. I think frequently in the musician space, things like Alexander technique have dominated, and I think that's a wonderful technique, but incomplete, and that some more breadth could be added to those. But I also think that it seems like there's an older generation that is not that interested in it as well, and I think that there's going to be newer teachers, newer pedagogues who come through, and they're going to be, I don't think, so me being a physical therapist, I don't think that I can make that change. I think some of that change has to come from within the university settings, and that musicians need to kind of demand that from universities and select where to go to music school based on how well that school is going to help them take care of their body as well as their music. And until the demand's there, I think that's going to be the key to things is, you know, people like you putting things out there in the world saying, hey, musicians, there's problems with your health and it doesn't need to be that way. They're going to start to pick it up. And as they pick it up, the schools are going to pick it up and they're going to start to deliver more. I think more than if we are saying, hey, you need to do this. Yes, exactly. And here we are conducting a research on performance-related injuries. We have named it MuseMuscle. I will send some videos of you. I'll be happy to know your opinion about that. Okay, Cody, we reached the limited time. I will stop this live, share it, and go live again. Please send me the request, and then I will open the comments for the questions. Great. See you in a couple of minutes. See you in a minute. خب من این لایو رو قطع میکنم، تایممون داره تموم میشه. لایو رو دوباره شروع میکنم. کامنت ها بازه، فقط سوال میپرسید. دیگه مطالب داشتید تموم شد، میریم صرفا برای سوال پرسیدن.